Hello friends, today we will learn about addiction. There are various types of addiction and how you can treat addiction. So, let's begin. Some of the people have alcohol addiction, some have caffeine, cannabis, hallucinogens like PCP and LSD, hypnotics, sedatives and anxiolytics, that is anti-anxiety drugs such as sleeping pills, benzo, uh, benzodiazepines and barbiturates, inhalers such as paint thinners, aerosol sprays, gases and nitrates. There are 4C addiction. What do we mean by 4C addiction? First, 4C means craving, compulsion, control, and consequences. Cravings. These are the 4C of addiction. National Institute of Drug Abuse, in short NIDAS, mission is to lead the nation in bringing the power of science to bear on drug abuse and addiction. This charge has two critical components. The first is the strategic support and conduct of research across a broad range of disciplines. The second is ensuring the rapid and effective dissemination and use of the results of that research to significantly improve prevention and treatment and to inform policy as it relates to abuse and addiction. Drug Free America Foundation Inc. is a drug prevention and policy organization committee to developing, promoting and sustaining national and international policies and laws that will reduce illegal drug use and drug addiction. A component of the executive office of the President, ONDCP, full form is Office of National Drug Control Policy, was created by the Anti-Drug Abuse Act of 1988. ONDCP advises the President on the drug control issues, coordinate drug control and related funding across the federal government, and produces the annual National Drug Control Strategy, which outlines administration efforts to reduce illicit drug use, manufacturing and trafficking, drug related crime and violence, and drug related health consequences. Drug policy alliances, that is in short, DPA, is the nation's leading organization promoting to alternate to current drug policy that are grounded in science, compassion, health, and human rights. According to the World Health Organization, there are some skills to recover from drugs. First is communication and interpersonal skills. Second is creative and critical thinking. Third is problem solving and effective decision making. Fourth is self awareness. Fifth is assertiveness and self control. Sixth is resilience and the ability to cope up. Addiction can be either physical or behavioral, and often they go hand in hand. Though alcohol and tobacco are commonly recognized types of addiction, there are actually hundreds of types of medically and scientifically recognized addictions. Addictions is a complex disease. The type of addiction does not really matter as much as the underlying issue causing the patient to chase that perceivable feeling while incurring adverse consequences. These adverse effects with the development of addiction can include financial issues, financial issues, family conflicts, and the negative feeling that come up as a result of these things. Let's know about the physical addiction. There are the ones that are generally better known. There are addictions to substances that are ingested or otherwise put into a person's body. Let's know about some common physical addictions, that is alcohol, tobacco, opioids, prescription drugs, cocaine, marijuana, amphetamines, amphetamines, hallucinogens, inhales, PCP. Physical addictions can generally be grouped into three categories: alcohol, illicit drugs, and prescription drugs. Alcohol, alcohol addiction is arguable among the most common. It manifests in the form of alcohol dependency, binge drinking, or regular behavior drinking. Alcohol addiction often starts with social drinking and then progresses further and further until one finds them or herself dealing with an unbreakable addiction. Illegal drugs cause long-term changes to the brain and other organs, leading to serve addiction. Prescription drug addiction is using approved medications in any way that has not been prescribed by a doctor. This is becoming increasingly problematic in every area of the world, mostly in USA. Now let's know about behavioral addictions. This is classified as any time that one loses control of their actions in order to engage in behaviors that results in brief feelings of happiness. That person becomes dependent on the pleasurable feelings that come as a result on the pleasure that comes as a result of certain behaviors and begins to compulsive act on that behavior. Let's know about some common behavioral addictions. They are food addiction, sex addiction, internet addiction, pornography addiction, using computers or cell phones, video game addiction, work addiction, exercise addiction, spiritual obsession, that means not to be confused with religious devotion, seeking pain, cutting, shopping addiction, exercise, gambling addiction, etc. Now let's know about the signs of addiction. Addiction manifests itself differently in each person and signifies of addiction vary based on what the person is addicted to. Thus, drug addiction changes the body, specifically the brain, and can have visible physical side effects. Behavioral addiction does not exhibit the same physical symptoms that accompany drug and alcohol addiction or substance abuse. There are some signs of addiction that are not significant amount of the time spent using substance or engaging in the behavior. Inability to quit using or engaging in the behavior. Inability to fulfill obligations at school, work, or home. Relationship or social problems. Increased tolerance. Withdrawal symptoms upon quitting. Previously enjoyed hobbies abandoned. Dependency is when a person needs something in order to function normally and is often accompanied by increasing tolerance and symptoms of withdrawal when the drug or behavior is no longer present. It is a gateway to addiction. A person can be dependent without being addiction if it does not cause a person to engage in compulsive or harmful behavior. If you find yourself or a loved one becoming dependent on any substance or behavior, it is important to seek help as soon as possible to avoid getting to the point of addiction, which is even more difficult to overcome. Now let's know about the treatment. How you can treat these addictions. Both genetic and environmental factors influence decisions and circumstances that lead to addiction. It is a confusing and challenging path to travel, not only for the person suffering but also for their friends and family members. It is important to know that no addiction, regardless of what it is untreatable. Professionals can effectively treat addiction of all types, both physical and behavioral. Personalized treatment plans allow people suffering from addiction to ease through withdrawal and learn to live without their addiction. It is possible to return to a healthy life with the help of the appropriate behavioral therapies, medication assisted treatment, exercise, and a sense of community. There are a variety of treatment options available, and our compassionate treatment team is here to help with your substance abuse disorder, whether you choose residential treatment or outpatients. Addiction is indicative of other underlying issues and is a way to self-medicate for the patient. Addiction recovery services includes cognitive behavioral therapy, dialectic behavioral therapy, family therapy, MAT, a routine exercise regimen, and a sense of community. These are some organizations are giving such therapies. Thank you. Finally finished. Any questions regarding this, you can ask me in the comment box and subscribe my channel for to know more updates. Thank you.